Hey everybody, I'm Dr. Seiler from Seiler Skin, and we're going to do a really unique treatment today that we don't do a lot of. This is a very rare treatment to do. Our patient here has been a patient of mine for about 5 years. She had a tattoo on her arm that was removed prior to coming to see me at another location, and she had some pretty significant scarring from it. They did a great job to remove the tattoo, but she had a lot of gnarly scar, a little bit of hypertrophic and keloiding. So back in 2014, about 5 years ago, we did 3 rounds of CO2 laser resurfacing, and we were both surprised. It made a huge difference in her arm, significant reduction in the scarring. Recently, since we started doing PRP procedures, we've really specialized that in for a lot of different things, but especially for scars. So we did a PRP treatment on her a couple months ago, and now we're going to do another round of CO2 with both topical and injectable PRP afterwards. To give her just even more reduction. The scar is probably about 80% reduced, much better than it was before. So you'll still see me do the Deep FX CO2, which is the deep treatment. You'll still see me do the Active FX, which is the more superficial ablation, which will really tighten that tissue. And then because that removes tissue, that opens up the channels to put the PRP on topically, and then I'll also inject it. And I think we'll get a really good result. So let's get started. All right, so we're going to start with the Deep FX CO2 here, and you'll see that. Let me get it started. All right, good. So this is the deep treatment. This is going to just drill. Luckily for our patient here, she's had this done before, so she knows what this feels like. She's doing okay? Pretty numb. We did some extra numbing time on her to really make sure that we let the numbing cream sit on there long enough. For those of you that are watching this for training purposes, we tend to leave our numbing cream on for about an hour and a half. I think it really gets into the deeper skin better that way. Makes the patient tolerate it a lot better. So this is going to really stimulate collagen and scar remodeling. Good. So we're going to do the active effects now. This is a little bit harder, but we're going to do this fast. You ready? Here we go. 1, 2, 3. So you can really see this now. It's making all these little white spots, which is ablating the skin. Right? Tell me if you need a breather, okay? This is kind of uncomfortable, but not too bad. She's tolerating it fine, but we'll be done in about 2 minutes. I'm going to try to go to the side here a little bit so the camera can see it. You'll see that we'll just cover this whole area, okay? Sometimes scar tissue is kind of sensitive, so it's a little uncomfortable for her. We'll be done soon. Break. You okay? And then after this, we will put on some topical PRP, which will help to really stimulate collagen and healing. And then we will inject it too into the areas where we know there's a little bit thicker tissue. Almost done there. You can see here that I'm kind of doing what I call feathering or painting, which is not full pulses on the rim, so that we kind of blend it in a little bit. Almost done, about another 10 seconds here. Alright, all done. Alright, so now we finished our CO2, so now what I'm going to do is I'm going to put a little bit of PRP topically. Remember that PRP's got to get into the skin some way, so we do it with microneedling, we can do it with CO2, because CO2 is going to remove skin. You okay? So this will help to actually, believe it or not, this will actually really help to heal, soothe the skin so that the heat starts to go away a little bit quicker. We've been doing this after CO2 now for about 4 years, and I think not only the results better, but patients heal a lot better from it. You can see that we don't need a lot. This will saturate the skin really good here. For those of you that are doing this for training purposes, if you're going to do it the way I do, which is to put a needle on it, just make sure you don't stick yourself. And then I can feel where the little bit of texture is left, so what I'm going to do now is I'm going to go in and flood a little bit. We still got some numbing cream in there, so hopefully you don't feel this too much. You feeling this much? You okay? Okay. This will help to get the deeper scar tissue to really soften and heal better. The last time we did this, about 5 years ago, her scar was much thicker, and it did take her a little bit longer to heal than I think it will this time, but it still only took her about a week. I think we're going to heal even faster this time and get even better. You can tell that that tissue right there was still a little bit thicker. I had a little trouble getting my needle through it. If you use a 30 gauge needle, sometimes it's a little hard to push the PRP through it, but it will go through the skin a little bit easier. Raise a finger at me if you need a break, or if you feel the needle starting to get a little bit numb, let me know. I always want to keep a good, fresh, sharp needle on it, because once it starts to get dull, then it hurts more going through. You see, she's not really bleeding much, so that's good. I'm going to squirt a little bit more up here, and you feeling the heat coming in?